More than 350 Indonesian healthcare workers vaccinated with China's Sinovac vaccine got COVID-19 and dozens are hospitalized, raising questions about the vaccine's efficacy on variants.
Here's a summary of the article.
More than 350 Indonesian healthcare workers who were vaccinated with China's Sinovac vaccine caught COVID-19, Reuters reported. 5,000 healthcare workers are currently dealing with the outbreak, about 7% of whom have become infected. The number of workers testing positive has prompted officials to question how effective the Sinovac vaccine is against variants. The data shows they have the Delta variant, so it is no surprise that the breakthrough infection is higher than before, because, as we know, the majority of healthcare workers in Indonesia got Sinovac, and we still don't know yet how effective it is in the real world against the Delta variant, Dickie Budiman, an epidemiologist at Australia's Griffith University told Reuters. Last month, Indonesian health officials said the Sinovac vaccine was estimated to be 98% effective at preventing death and 96% effective at preventing hospitalization. The statistic came after 128,000 healthcare workers who were vaccinated were monitored between January and March, and it was found that 94% of them hadn't caught symptomatic COVID-19. They were the first to receive the Sinovac vaccine in January.
This post received a score of 8,000, with an upvote ratio of 92%. Here are the top comments in response to this article.
Indonesia already released a statement clarifying the Western media reports.
Yeah, this seems to be a trend across the vaccines. Even if you still contract a variant of COVID-19 after vaccination, the risks of serious complications are dramatically reduced.
That's the whole point. And as much as China bashing is en vogue these days more than ever, they never once claimed that their vaccine is 100% effective, but rather a solid step towards reducing the severity and preventing deaths.
I don't know why people can't seem to understand this. No vaccine is 100%. They are to hopefully prevent a person from getting COVID, and if they do, small chance, but can happen, they will most likely not have a severe case or die.
I think it's because with most of the other things we get vaccinated for these days, we've also, ignoring anti-vaxxer pockets, achieved herd immunity against. So up until now, vaccination for the general public is functionally synonymous with, never have to deal with this disease in my life. That's not medically accurate, of course, but not understanding how vaccinations work is part of why we're having such an issue with the rise of anti-vaxxer misinformation. They're very confident in their ignorance.
Also, the term immunity in a medical setting doesn't mean what people normally associate the word immune to mean.
My great-uncle got 2 Sinovac shots and caught COVID about a month after his second dose. However, we still consider the vaccine as effective. Why? Because he's 74 years old, a diabetic, and very hypertensive. Yet he's completely asymptomatic, only found out he caught COVID when he was randomly selected for a swab test, and is expected to make a full recovery without needing any medical care. If not for the vaccine, he most likely would have been dead by now or fighting for his life in the ICU.
Greater than because he's 74 years old, a diabetic, and very hypertensive. Yet he's completely asymptotic. Damn, that's like the whole package. Glad your uncle did not have any complications.
1. Out of how many? 2. Of those hospitalized, how many died? 3. Why does the media blame the variant for the surge in the UK, but the Chinese vaccine for the surge in Indonesia, when both places have a surge in the Delta variant? I wish mods did their job on this sub from time to time.
I think Indonesia already had something like 11 million vaccinated, so 350 is a really small percentage. Even if all 350 vaccinated individuals were hospitalized, that's like 0.003%.
This video was automatically created by Reddit to speech. The article and comments in this video were selected from Reddit according to their upvotes, and any paraphrasing was performed by smmry.com, without any human intervention.